Hi, we are back again, and we're going to study from Nursing Health Assessment. Okay, now we have been doing this for about a day, and we need to continue. Today, I want to talk about abnormal abdominal findings. So there is obesity, gaseous distension, and abdominal tumor. And so we are going to read from it, okay? Obesity causes protuberance of the abdomen, resulting in a thickened abdominal wall and fat deposits in the mesentery and omentum. Percussion sounds over an obese abdomen present a normal tympanic sound. Gaseous distension. Gaseous distension is a result of increased production of gas in the intestines from the breakdown of certain foods and fluids. The average adult passes 500 milliliters of gas per rectum per day. It is also associated with altered peristalsis, in which gas cannot move through the intestine. The altered peristalsis is seen in paralytic ileus and intestinal obstruction. Gaseous distension can be found in one area or generalized over the entire abdomen. Percussion sounds will be tympanic over the area of distension. Abdominal tumor. A large abdominal tumor also produces abdominal distension. The abdomen over a tumor is firm to palpation and dull to percussion. Ovarian and uterine tumors are common types of palpable tumors in the abdominal cavity, despite their pelvic origin. As organs enlarge from the tumor, their mass protrudes into the abdominal cavity. Now, we could have read a little louder, but I hope that your speaker accommodates for that. Now, Eugen, without reading it over again, how would you explain it? Now, when it's been a while since I studied. So when you assess a patient, you can look at them visibly, you can listen to them, and it's called auscultation, and you can feel it. You can put your hand on it, you can feel them, and it's called palpation. Now, I do believe there was one more, and it escapes me at the moment. But this requires this distinction between obesity, gaseous distension, and abdominal tumor. Probably has to do with the palpation part of the assessment. Usually, palpation is done on the abdomen. You can also auscultate the abdomen, and when you do that, you have to listen for bowel sounds. So, you divide it in 4 quarters. And in each quarter, in each section of the quarter, you are supposed to hear sounds, maybe not too often, but maybe up to like 5 to 10 times during a minute, or even about that time. If it's too fast, there's probably a problem. If it's no sound, it's definitely a problem. It means that there's no peristalsis going on, which means that the bowels are not moving, and that means that the food is not being digested. So that's a problem. Now, obesity is because you've gained fat, and it says here that it results in thickened abdominal wall and fat deposits in the mesentery and omentum. I do know that mesentery is a vessel name. It designates to a certain section in the in the abdomen. Maybe possibly that has to do with the liver, possibly. So probably the liver. But everything is normal. It's not an abnormal sick sort of thing. It's not a disease, unless, well, you cannot exactly call it a treatable, like fix something, like it's not an official disease in my opinion. That's what I think. Gaseous distension Now this has the important thing here is that paralytic allows. Okay, so what it means is that I explained about peristalsis not being there and there's no sound, right? It means that the intestine is blocked. Now, if that occurs for a long time, it can rot. It means the tissues can die, the cells come together. When there's many cells, it can be called a tissue, and these tissue cells can die. And that means that a part has to be cut out, and it's a serious disease. It's a serious condition. So you if you feel that you're maybe possibly if you feel that you're just feel like you're bloated, and well, something is not right, and you try to put a stethoscope to your abdomen and you hear no sound in one of these four quarters of your abdomen, I say you go to the doctor and you check it out. Okay, so that's what I say. And that's paralytic ileus and intestinal obstruction is somewhat similar. How the difference I cannot exactly quite tell you right now. I cannot quite tell you right now. Abdominal tumor is there's a tumor in the abdomen, and especially it says here most of it is probably enlargement of the ovaries or uterus. So probably these are more women parts of the body, woman body parts. Ovaries or uterus. Like if these parts, if there's a tumor in these organs, then your abdomen can blow up. Okay, so if you feel something there, you palpate it and you feel something there, do check it out. So that's all I have to say. Okay, no, okay. Thank you. Thank you so much.